Well, as a general rule in orthodontic treatment, generally 85% of the population actually needs some form of active orthodontic treatment to improve their bite and to get a beautiful smile. We tend to find that of the 15% that don't require it, well, we don't often see those patients come in, but by and large, most patients do actually need some form of active treatment.
Definitely. The most obvious reason is crooked teeth. So people know that their teeth are crooked. But a lot of people don't realise that they could be grinding their teeth and their teeth are getting damaged or worn down. They accept that as a normal part of life or the ageing process, when the sad reality or the happy reality is that we can actually fix that. By fixing their bite, we can actually stop them grinding their teeth. So as they get into the older years of their life, they have teeth that are essentially well preserved and lasting them their whole life.
Occasionally, sometimes we see younger patients that perhaps have had baby teeth removed early because they've had problems with those teeth. And the problem with that is once they're removed, you often find there's crowding and there's issues as they get older. So you tend to find if you've had to have baby teeth removed for whatever reason, an abscess, decay, that almost always there's going to be an orthodontic need as they get older. So that's something to look out for in your children.
Definitely,
when they have teeth removed early.
Definitely, and in addition to the grinding that we talked about before, often it's related to headaches as well, and people put up with headaches. They just accept that headaches are a part of life. And with the exception of a true migraine, which is a vascular or blood vessel condition, most headaches in the temple regions, that's this area of the head, are usually bite related. So if they fix their bite, those headaches will disappear, which is a wonderful thing because no one likes to be in pain. The other aspect, of course, is parents. You may have looked at your youngster and realised that they've got a gummy smile. In other words, they're showing too much gum when they smile or when they talk. That's actually fixable as well if you get them while they're growing, and we can fix that quite nicely. In an adult, it's more comprehensive to fix that, and it's much more complicated. But if you certainly pick up a younger person, you can fix that for them as well, and that's a great benefit aesthetically.
That's right. And in some patients, particularly in patients that are growing, there's the ability to slightly widen the jaws and accommodate space for more teeth, whereas as they get older, sometimes that's more restrictive, and you tend to find that possibly we might need to take teeth out in patients that are older in cases. So in some cases, because they're younger, you can get a little bit more expansion out of some of the cases. And that just means that, we don't have to take teeth out to improve their smile.
I think, and the other aspect is a lot of dentists are really happy once we fix their patients' teeth, their crooked teeth, because once the teeth are straight, they can actually keep their teeth cleaner. And it's important to keep your teeth clean because it prevents gum disease in the future. As you get gum disease that progresses, you tend to lose bone around the teeth, and the teeth start to get a little bit wobbly, and eventually they can fall out in extreme cases. So it's a wonderful side benefit of braces and getting a beautiful smile and straight teeth to actually have teeth that are easier to clean, easier to maintain, and more likely to last your whole life.
Absolutely.